Good morning, everyone. This is Dayna Wilson, your host and moderator for the Savvy Seniors Living Seminar Series. And I am just thrilled to welcome everybody here today. We've got a great topic and we've got amazing speakers and panelists for you today. So a lot of knowledge on this screen right now, and they're going to impart as much as possible with the time allowed. But just as a background, I know we've got our groupies that come almost every month. We probably have some people that have come every single month since we began in June 2017. And I bet you anything, we've got some newbies in the crowd as well. So welcome to the series. And I hope that you find some good information today and that this time is beneficial for you. And you leave with a couple ahas or new nuggets of information that you didn't have before. And if nothing else, sometimes we need to hear the same thing multiple times before things start to sink in or really put our plans together. So you know my soapbox, I'm always up on my soapbox saying create that what if plan for today and the future. And just understanding this topic today is part of that plan. So as a reminder, the Savvy Seniors Living Seminars was initially created to engage, empower, educate, and inform. And we hope we continue to do that for you. And please invite your friends, or neighbors, anyone you know that you think might find these sessions of value. As a means of a little housekeeping, we'll get that out of the way. I have to point out that we have some amazing sponsors that without them, we could not continue to bring these presentations to you, which are free to everyone. And we have got platinum sponsors, beginning with Annalise Morris, with Merrill Lynch Financial Planning and Advisories. We have got Byron Park, Paula Carrillo, and she is Byron Park Assisted Living, Independent Living. And we've got Care Patrol, Mike Awadala, and that is placement, transition, management, helping people find great assisted living and board and care situations when needed. And then we've got amazing silver sponsors. And one of them is our panelists today, which Dale and David with Arosa Care, formerly known as Live Home. So I just wanted to point that out in case you're wondering what happened to Live Home. They're now Arosa Care. We have got Oakmont of Montecito, Kayla Olson. We have got Carlton Senior Living, Mary Grafilo, that's the Pleasant Hill Martinez, which we used to call Carlton 1 and 2. We've got Mutual of Omaha Mortgage, Reverse Lending, and Efficiency Matters, Jennifer Raftis, Organizing and Move Management for Home and Business. And of course, Dayna Wilson Real Estate Team is a platinum sponsor as well. So any of these sponsors are here to answer your questions or help you with anything you might need. So keep them in mind. And when we send out our follow-up emails, all their information will be there, as well as all of the information for our speakers today. So don't fret if you are wondering, well, how do I get a hold of Bach or Sherry or Dale or David? We'll make sure you have that information by the end of the week. So with that, one more thing, and that is just to give you a heads up on the upcoming seminars. Next month, it will be independent versus assisted living. What's right for me? What's the difference? What is assisted and what is it not? So I think that's very important. Then we'll go on with living purpose and leaving your legacy. And that's going to be really interesting too. And then we're going to end 2021 series with proper planning prevents disaster, taxes, wills, trusts, and financial information. And it's all very, very important. There's been a lot of changes happening. So with all that, thanks for hanging in there. That's all important stuff I wanted you to know, but we're going to get right into it. For today's panel, the topic is staying put No, in-home care. I'm sorry, in-home care, your home, your choice. And so, what is that? And there's a lot of differences. So what I'm going to start with is just jumping in and asking Sherry to introduce herself to us and tell us a little bit about, who she is, what she does, how long she's been doing it.
Thank you, Dayna. I appreciate it, and I'm happy to be a part of this amazing panel. These are great colleagues of mine. I'm Sherry Maxwell. I'm with Bright Star Care. I've been with Bright Star since January of 2011. It's a second career for me. I was with AAA for 25 years prior and felt it was time to do something that I was felt I was called to, and I'm passionate about it. I'm the director of client care, so I help meet families that are exploring options with regards to home care. So glad to be here. Thank you.
Thank you for your time today. Hey, Bach, tell us who you are and what you do.
Good morning. My name is Bach Pregil. I'm the owner and director of Better Days Provider. We are a non-medical in-home care service company located in Walnut Creek. I've been in the home care industry for 20 years. I started as a caregiver and became an operations manager and a care coordinator. 12 years ago, I founded Better Days with the goal of simplifying in-home care services. And I'm very, very happy of what we do.
Awesome. Awesome. Dale, who are you?
Hi, my name is Dale Martin. I'm the area director of Arosa East Bay, servicing Contra Costa County, Alameda County, and Solano County. I've been in home health or home care for 20 years. I've worked for franchise companies, independent, corporate. I've owned my own home care company, and I've been with Arosa, formerly Live Home, for 5 years. I'm the area director. I started out doing staffing coordination and went into operations and management. So I've pretty much done every job in a home care setting at some point in my career. And thank you for the invite, and I'm happy to be here. And we provide non-medical home care and care management services.
Awesome. And then who's this Mr. Green we have here today?
You can call me David, and I'm also in the Arosa East Bay office. I work closely with Dale. My background is clinical psychology, and I've been working with seniors for 2 centuries, since the last century. I got my master's degree, my first in clinical psych, and my first internship was at the Jewish Home for the Aged. So I've worked with lots of different populations, but I've always been focused on seniors. Before coming to Arosa, I worked for the city of Oakland, providing care management services, and I've been with Arosa now for 10 years, and supervising caregiving services and also providing geriatric care management.
My gosh.
Glad to be here.
That's awesome. Thank you so much for your time today. Also, we've got an amazing group of people here, as you can see, and a lot of experience, a lot of tenure here. So with that, Sherry, I'm just going to jump in and start with you. Under what circumstances would somebody, be thinking about needing in-home care? What usually causes someone to either start thinking about this or wondering about it, or even picking up the phone and calling?
Well, Dayna, typically it's after a crisis. Someone's had a fall, they've been hospitalized, there's been a death of a spouse. Typically it's a crisis that leads somebody to making a phone call, or the kids are noticing that there's a situation in the home that needs addressed. We don't typically see planning ahead.
I understand. Yeah, I can see that. Dale, if you aren't sure if your loved one needs care, right? How would you know? So, Sherry mentioned the kids start to notice something, and I find that happens a lot right after the holidays. Things really pick up because adult children have maybe spent some time with their older parents. How would you know when the time might be right for a loved one?
Yeah, that's a very good question. Like you said, lots of times when you're just living remotely and a son and daughter calls someone, your parents are going to tell you they're fine. So usually when you go into the home and actually see them for the holidays, you'll notice that the house is unkept. Maybe the yard, the weeds haven't been pulled, the lawn hasn't been mowed. Things in the refrigerator are spoiling. Family members are forgetful. Mail's piling up. So that's when you probably want to bring in a professional and have them do an assessment. It's free of charge, and let them, assess the situation for you and determine what care might be needed.
Right. Bach, tell us more about what the assessment is.
Yes, with the assessment, it is, the time that you can ask questions that you have. We can give you more information of who we are and what we do and how we do things. Assessments are educational and informative. So if you need help, you can always call for a free assessment with no obligation to hire us.
That's awesome. Does anyone want to jump in and add anything else about knowing when to call or about the assessment?
I might add that you can always call if you're unsure if somebody needs care, because we enter a gray area. It's not as though on Sunday this person didn't need care, on Monday they do. And often it's a long process to getting people to say, yeah, okay, let's start some care. So that's part of my assessment, is having a conversation with people about what their values are, what their tolerance of risk is, what we can do to minimize risk, what services are available in addition to having caregivers in the home. And so sometimes that conversation can lead to a foot in the door, so to speak, a little bit of care, so that we're ready when things are changing to increase the level of care and the support.
That's a really good point. Thanks for bringing that up.
I think too, Dayna.
Oh, yes.
Real quick with that. When you have parents that are resistant, it's good to get them involved in a conversation early on. Let them ask questions, address their concerns or their resistance to the care. And while the person is there doing an assessment, they can do a home safety check where they go through and look for things that might present a fall risk. There could be extension cords, there could be throw rugs, things like that. So I think it's part of the assessment as well as just the living environment and safety.
Wow, you guys both brought up, all of you, really, really good points. And a couple of things that I wouldn't have thought about, right? The safety assessment, right? And also the point that, yeah, you don't go from Sunday not needing care and then Monday all of a sudden you do. It's a situation. And then the things that Dale mentioned as far as, what to look for. And I see that at my clients' homes too. So I know one of the fears for older adults is allowing someone into your home and really, who are these people? Who has vetted them? How have they been screened? Are they going to steal your silverware? How do you trust these people? And so, let's ask about the security risks and how caregivers are screened. And do all care companies have that same level of vetting? So Dale, I know you were sharing with us about licensing and different levels. Would you kind of address that for us?
Sure. So the way I look at it, there's pretty much two options. You can hire a caregiver privately, or you can work with a company like ours that's licensed by the Department of Social Services. All of the individuals on the call today are licensed home care companies. And that's going to give you a pretty high level of security. We're licensed, we're bonded, we're insured. The employees, all the caregivers are employed by us. And as far as screening, the state holds us to a standard where we have to screen caregivers for 2 professional references, and we also live scan them, meaning that Department of Justice and the FBI does a national background screening and puts them on a caregiver registry. So all caregivers are vetted out in this process, and those are the only caregivers that we can actually use and it's overseen by the Department of Social Services.
Interesting. I don't even know what the Department of Social Services is. What branch are they under?
Does someone else want to answer that question?
Maybe we don't know. Well, we can look into that further later. Bach, you were going to talk about having a caregiver ID.
Yeah, so part of the background checking, once they completed that, once a caregiver passed the background check, the state will assign a home care aid number, or in other words, HCA number. And this is renewable every 2 years. With the HCA number, you can now check the status of a caregiver on the state's registry website.
So let's just say worst case, Susie Smith has been assigned to a family and she did something that she shouldn't have. What happens to that number, and who is going out and checking on these people?
So there will be a record for this particular caregiver that, number one, she won't be able to renew her HCA certification, and there will be a note at the bottom of his profile on the website. So the website is for public use. So a client or company, people like us, we can access the website.
And that's similar actually to realtors, right? You can look up and see if a realtor has had any issues. Same with even a contractor, right? There are websites for the public that you can use to check out people, which is great. Okay, so what can someone expect to pay for in-home care, right? Is it cheaper to hire privately? There's going to be a number of discussions about this, I think, because we want to talk about, does insurance pay for any of this? Some of it, none of it. And I think people have varying understandings of what this costs and then what you get for what you pay for. So Dale, why don't you speak a little bit about like the insurance portion of it, if you would?
Sure. So the easy answer is, if you have a long-term care insurance policy and you need help with assistance with daily living, which is bathing, grooming, dressing, eating, transferring, toileting, any of those things, if you need help with 2 of 5 of those, or you're deemed incompetent, meaning you have dementia, your long-term care policy will pay for in-home care. Is hiring a caregiver privately cheaper than working with a licensed home care company? In the beginning, yeah, it's going to be a little bit cheaper, but it's going to be at the cost of risk and safety issues that they may not be if you hire someone privately, you're going to have to do the scheduling. You're going to have to get insurance, and you're going to have to pay taxes for those individuals as well.
And this is, I think, what people fail to understand.
Correct.
That they will say, oh, well, my friend's cousin's sister was unemployed, and so she said she would help my mom, right? And so they're just sort of paying her under the table, and no one is running payroll, no one is paying taxes. And so what could happen in that case?
The individual responsible party, a client, could be held liable if you don't have, workers' compensation, unemployment insurance, if there's theft, if there's any elder abuse. When you work with a company like ours, we're mandatory reporters, and we would investigate, and we would have insurance to cover those things.
Huge. I mean, that's huge. Hey, Bach, what about live-in private hire? How does that compare to, let's say, hourly shifts? Because that's kind of confusing too.
Yes, so live-in, or most people call it round-the-clock care.
Okay.
Live-in caregivers work 16 hours per day, not 24 hours per day. 8 hours is allotted for sleep that totals to 24. So 16 hours of work, 8 hours of sleep. Now, California has very strict labor laws. State law requires caregivers to have certain amount of hours of uninterrupted sleep. This may vary, but most caregivers are very considerate. Occasionally, live-in caregivers will get up and assist you if you need help in the middle of the night. But if this happens regularly and the caregiver cannot get the uninterrupted sleep, then the live-in setup does not apply. And we have to think of other options, such as 2 12-hour shifts or 3 8-hour shifts. Most common question is, do they live in your house? The answer is no. They're only there during the duration of their shift. You may assign a room, hopefully close to where you sleep, that can be the caregiver's room. But a live-in setup can be great as it can minimize the number of caregivers per week. An ideal setup is one caregiver for 4 days and another caregiver for 3 days. You could have at least just 2 caregivers per week. This may vary. There are cases where we have 3 caregivers per week. It all depends on the level of care required, availability of the caregivers, and other factors.
Yeah, that's really helpful. Sherry, I think you're going to talk about 8-hour, 12-hour shifts, the price range. What does this cost?
So there is a range, Dayna, and some agencies, I think the range would be between $30 and $40 an hour. And with that, again, Bach was mentioning California has strict regulations, and a caregiver must be paid time and a half for any shifts over 8 hours or 40 hours in a week. So we do try to work with families and the budget. Some families would prefer fewer caregivers coming into the home, so they would prefer to pay a little bit more and do 2 12-hour shifts. And for others, it's not an option, so they have the 3 8-hour shifts. To Bach's point, that's a lot of people, and especially if you've got somebody with cognitive impairment or dementia, it can be really difficult on them because of the people coming and going and that. So you need to look at the whole picture. But that is kind of the price range, I would say. Dale, Bach, would you agree that it's 30 to 40 an hour in this area?
Yeah.
Sounds about right. So what about, are there long-term contracts that somebody is locked into? Are some longer than others? What about that, Sherry?
So most agencies have some type of a policy. I know for us, Bright Star Care, we have a 24-hour cancellation policy. So you're not locked into anything long-term. I've seen as long as 2 weeks notice. But I would say most of them are 24 hours to a week's notice to end care.
Got it. Okay. Anyone else want to add to any of that about expectations of paying or insurance or taxes or anything like that? No?
I might add that when people think about hiring privately, if they do have long-term care insurance, for the most part, the long-term care policies require that you're working with a licensed agency. So usually, and we facilitate making the claim as well. So that's another reason that people choose an agency.
Great point, David.
That's a big point. Really,
Yes.
seriously, who wants to handle their own payroll and trying to figure out taxes? I don't even know how that would work.
So Dayna, real quick, we get requests for someone to come just for an hour or two, just to help mom or dad have a quick shower, get their morning started and be gone. Mm-hmm. So I do want to talk about shift time. Several agencies have a 4-hour minimum, but there are some, such as Arosa, Dale, you might want to speak to this, that can accommodate a shorter shift, but there are some implications with that as well. So Dale, do you want to speak to that?
Sure. So we don't have any minimum hours that we require to sign up with us. But I will say this, if you do only want an hour, it's going to be a little bit closer to the $40 an hour. And you're probably going to get a caregiver that's not consistent week in and week out. We're going to tie it to an 8-hour shift, a 12-hour shift. So you need to be flexible with time. It would be probably, early in the morning or late in the evening, because the caregivers want full-time work. So this is just going to be tied to a schedule that they already have. And if that schedule ends, unfortunately, we're going to probably be providing another caregiver. So if consistency of caregiver is important to you, I'd really focus on trying to get 4 hours or more in the home. Even if you don't know exactly what they would do, they can find things to do as far as companionship, meal preparation to give you more consistency of care.
That's awesome. Yeah. So you guys are covering some really important things that I want everybody that is attending today to be considering, which is, what is most important to you? Is it consistency? Is it the number of people that are coming and going into the home? Is it the cost that you'll be, paying? And then do you want or do you care about handling the payroll and the insurance, the taxes, all that stuff? So as you can see, it's just not as simple as, you may think. There's a few things that you really want to take into consideration and think about carefully. Okay, we non-caregiving people sometimes get confused with all the different terms as far as in-home care. We just think it's sort of all the same. But there's a difference between home care, home health, hospice, and palliative care. And my gosh, okay, so tell us, Sherry, if you would, what these all mean and are, and then is there an order to this? Anyway, enlighten us if you would, please.
Okay, great question, Dayna, and it does come up quite a bit. So home care is the custodial type care that we've been talking about, having somebody come in and assist mom and dad with the personal hygiene, meals, medication reminders, errands, things like that. Home health is typically after a hospitalization. It's covered through insurance, Medicare, and it's for a specific period of time. You will get a few nurse visits to just check in after the hospitalization. They may provide in-home physical therapy and occupational therapy. But again, it's for a specific amount of time. There is also private duty home health, which is nursing that can supplement what is covered under insurance, and that's private duty home health. Some agencies such as Bright Star do have nursing availability to cover the gaps or extend it longer than what their insurance will pay for. We work in conjunction with home care agencies. If you need a nurse to come in and maybe do some medication management, set up medications, maybe check vitals, home care agencies that don't offer that can supplement with someone like a Bright Star to just cover that piece, but you can stay with your home care agency. You don't have to switch.
That's amazing. Can I interrupt? What
Sure.
would the cost of that be? Because I personally have a friend right now that needs that help, and she doesn't know what to do because they can't keep up with it, and mom is forgetting to take her medication, and either they're busy or they're out of town and they physically can't be there. What would that cost? Just that separate service for the medication management?
For the nursing piece.
Yeah.
So a nurse visit, it would be a licensed vocational nurse. It's within their scope of practice. It would be a 2-hour visit and it's $150. But with that, if they're there for the 2 hours, there are some other things that they could possibly help with. So it's a visit rate, and it can be as needed. So when a family member who typically sets up the medication is out of town, we can fill in. And again, it's one of those things when you schedule it. You also can have someone come in, say once every 2 or 3 weeks. It depends on what the amount of medications the prescription has, and we can set up several boxes for each week. So they don't have to come every week. We can look for ways to keep the costs down. But to also have just a nursing set of eyes on a situation, many other home care agencies do recommend that they add that piece at a certain time in a person's journey, if you will. And so it just really depends on if it makes sense or not. And it could just be, you know, an as needed type of thing.
That's amazing. So I just learned something. That's awesome.
Yeah.
Okay.
And same with diabetic management. Oftentimes families are helping their parents manage their insulin and that sort of thing. But when they go out of town and mom is on maybe, you know, insulin, they need somebody just during that time period to keep an eye to make sure she's getting her insulin, that she's measuring it properly and getting the right dosage.
So that's, you mean, so folks, think about that. If your kids or you or someone is planning a vacation, right? Or they have to go out of town for whatever reason, you know, think ahead about this and have someone teed up to help with that. So that's one less thing you have to worry about. So now I think we're moving on maybe to hospice and palliative care.
Yes. And there's a lot of confusion around that, Dayna. And there's also a stigma around hospice care. And I would like to address that. Yes, hospice care is typically implemented when the expectation is the lifespan is 6 months or less of the person. But I have seen, and I'm sure Dale and Bach have also seen, you put somebody on hospice care and they get the symptoms, the pain and the medication sorted out. I've seen people graduate off of hospice. They no longer require that, and they are thriving. So it's not necessarily I'm giving up on my loved one. Palliative care and also hospice care is covered under insurance. It's covered under the Medicare, and all of the medical team is through the hospice agency. You now are under the hospice agency's physician and nurses in that. You no longer go to the emergency room. You no longer go see your primary doctor. All of that is transitioned over to the hospice agency. Palliative care is a step ahead of hospice. We might be managing symptoms. They might be going through treatment. Psychologically is taking a toll. Palliative care for some agencies is covered through insurance. Others, they're not licensed for that. So you want to ask when you're interviewing agencies if their palliative care is covered under insurance or not, and if so, how much. But you can continue your treatments and you can continue seeing your medical team, your doctors. They work in conjunction. So it's different than hospice in that you keep your same medical team and treatment in place. But you get that added support of having a nurse come to your home and evaluate or see what's going on, so you don't always have to go to the emergency room.
Who provides
so it's just
that
a nice
care?
level of care.
Do all of your various agencies and others like yours provide this type of care, or is it a specific type of care company?
Great question, Dayna. No, home care agencies do not provide palliative or hospice care, but we do work closely with each of them because it only provides those nurse visits. And oftentimes there's still caregiving needs outside of what the palliative or hospice care. So we work in conjunction with them.
Oh, that's awesome. Okay.
Mhm.
So I know most of us know of a number of different hospice companies, if you will. Are they the ones that are also providing the palliative care, but it's just a different level?
Correct.
Okay.
Yes.
Perfect. And then I've even noticed, and I know we're going a little far afield, and maybe next time I have someone from a hospice agency, I just lost my train of thought. Oh, I know some of those are for nonprofit and some are for profit. And does that matter to us? I don't know.
I've
I think
worked,
it's a personal preference of who
Okay.
you want to work with and how they structure their company.
Okay. So they don't offer anything differently, David, as far as what their services might be?
I don't know that the client or the patient will notice a difference. I've worked with both nonprofit and for-profit hospice companies, and what I think is probably the biggest variable is you're going to have a nurse case manager maybe also a social worker, is your relationship with those people. So no hospice provider is better than the people working for them. So, you know, I have relationships with different hospice providers, and I work with people sometimes for years. And so I try and educate them about what hospice means. And Sherry was mentioning sometimes there's a stigma. I try and help them understand that paradoxically, sometimes people live longer when they choose hospice because there are fewer interventions, fewer trips to the hospital. I try and help them understand, find out what their values are. But if being at home is important to them, it might mean the difference between your end of life being in your own home or in the hospital. And so then when I have relationships with hospice providers, I can say, you know what, why don't you talk to this person or that person? And, you know, another fact people don't think about with hospice is they wait till the last minute. It's like, I really don't want to do this because I'm ending mom's life. Well, you're not ending it. We're not hastening the end. But so people don't get the full benefit. The earlier you start hospice, the more benefit you get from it. You get visits from the hospice nurse. They have on-call nursing assistants. So you get a level of support that can really improve your quality of life. So I really work with people. Full disclosure, I find hospice to be a wonderful benefit. My own mother was able to be at home at the end of her life. And so I'll share that with people. If I sense that it's not someone's values, that boy, they want every intervention possible, and I try and make sure this is what the client wants, not just the family member, then we'll step away and say, okay, hospice is not for you. But I would say for the vast majority of people, hospice is a good choice.
That's
And
awesome.
David,
Thank
with
you.
that, it really is helpful for the family. Oftentimes the person is ready to go. They've had a long journey. They're tired of fighting, but the hospice team with their social workers and bereavement counselors and that help prepare the family to let go and let the family members give permission to their loved one to go. But it's a journey, and they're just very compassionate and comforting as walking the whole family through this journey, not just the patient, not just the individual whose journey is coming to an end. I think you're right, David. It's helpful for all of us to try to educate people early on, because so often it's started much too late.
Yeah, hospice is scary for many people at the beginning, but it is a great support at home. You know, you can call in for those on-call nurses. You know, some hospice agencies, they provide even supplies, equipments, hospital beds or wheelchairs or some other equipments that you or your loved one may need. So that's a great support at home.
Well, Bach, as long as I've got you, I'm going to switch gears a little bit and ask, what types of expertise or training do caregivers get or have?
Okay, so we can teach skill sets, but we cannot teach personality. To match a client with a caregiver, it has to be a good match. Number one is personality, with the right work ethics also. But in terms of trainings, we train them once we hire them and continuously during their employment. Training includes safety and precautions, emergency procedures, infection control, detection of elder abuse and neglect, and how to assist the client with personal hygiene, transfers, and activities of daily living. Privacy or OSHA training, sexual harassment, and especially now with COVID trainings as well.
Awesome. And David, care managers, again, we're going to be learning more about the difference between a caregiver and a care manager from you in a little bit. But what type of training and expertise does a care manager have, and how are they different?
Well, care managers come from a number of different backgrounds. It's a multidisciplinary field. So there's an organization, the Aging Life Care Management, Aging Life Care Association, ALCA. and there's a certification process. So you may see CMC after a care manager's name. And these people may have backgrounds in nursing, gerontology, social work, psychology. Sometimes they come from fields like physical therapy or occupational therapy, but we all have a focus on geriatrics. So, and the way we differ, we're not providing that hands-on care with bathing or dressing her in the home, but we're always starting with an assessment. So that means knowing who the client is, understanding. I always talk about values and what's important to the client, but you're doing an interdisciplinary assessment. So you're looking at their health, their functioning. Are they ambulatory? What can they do? What can't they do? Their physical environment, as Sherry was talking about, home safety assessments. You know, is the home safe? The social supports, are they isolated? And emotional supports. We're looking at all those kinds of things, nutrition. And then once we meet somebody, we are assessing what works for them, because we don't want to be deficit focused all the time. So let's support the things that are working. And then if we see risk factors, how do we reduce those risks? What are the needs? From that assessment comes a care plan. And so the care manager's job is to develop that care plan and share it with the client and family or whoever is involved, and figure out how to implement that care plan so that you can help somebody have the best quality of life.
Okay.
Oftentimes that means putting caregivers into place, but many other
Okay.
things. as well.
And I'm going to, excuse me, I'm going to get to that in a minute. But thank you so caregivers and care managers are very different. And
Yep.
it sounds like they work in conjunction with each other.
Yeah, and as a care manager, I'm supervising.
Awesome. Well, all right, Sherry and Dale and Bach, how, and this is a big question, how has COVID, Sherry, changed in-home care? What changes did you see, since the pandemic hit us?
Significant changes, Dayna. The demand is much higher. Family members are, initially, they were taking loved ones out of assisted living and board and cares and bringing them home. We had family members trying to work from home in mom and dad's house to take care of them, and found out quickly they were over their head. And so the demand is much higher than resources available. There is a shortage, not just in California or the East Bay, it's nationwide. There's a shortage of caregivers and nurses right now. And then the whole issue of vaccinated and unvaccinated. Every agency has worked diligently to try to get all of our caregivers vaccinated. You do have some that are not willing to, or have reasons why they feel they can't. So we've had to put strict mandates in place with regards to regular testing before going to shifts and things like that. And then the mask mandate, they must wear a mask the entire shift with their clients. And even those that have been vaccinated and our clients are vaccinated, we thought for a short time period that it would be okay to not wear masks. But with this new Delta variant, we must still wear masks and be protected, because it's spreading even amongst people that are vaccinated. So it's really challenging, and our caregivers are doing an amazing job. I will say that our agency is just over 90% vaccinated. But if somebody requests only vaccinated caregivers, I have to honor that. And so we cannot use caregivers that are not vaccinated. So for us, we are only hiring vaccinated caregivers. They must be fully vaccinated before we interview. And I'm guessing that Bach and Dale, you all are probably similar. So add to whatever you guys want.
Yeah, we do have similar procedures and protocols regarding mask mandates, vaccination records, and also PPE, the personal protective equipment. So we provide PPEs like hand sanitizers, masks, in some cases face shields, and if we've known some exposure, we provide gowns and boot socks and some other supplies as well. So it's been challenging to be in this industry during the COVID, because the age group that we serve are those who are at high risk. So it's been challenging, but we're just so glad that we're surrounded by good people. My colleagues here, we call each other to help out each other. So it's been great.
Dale, anything to add?
I think Bach and Sherry did an amazing job talking about the differences now that we're in COVID. The only thing I would mention is the PPE, asking the companies that you're working for who's paying for that and what their policy is around PPE and mask wearing. Like our company, we provide the PPE and bring it out into the home. We do, grab and goes and give all of our caregivers specific training around the PPE and what to do. And then another question I would ask in these COVID times, does this non-medical company provide care to COVID positive individuals?
No, that's a good one.
Not all non-medical home care does. So that's something you would want to do. And if so, if they're doing that, how are they training their caregivers and what support are they providing?
Wow.
Great
Well,
point. And
yeah.
Dayna, real quick too, with
Yeah.
COVID, because there's a caregiver shortage, many agencies now have wait lists. So again, planning ahead, if you anticipate needing some care, it would be good to research early. Those of us on the call here are a part of the Contra Costa County Home Care Collective. And that is something that John Muir initiated about 5 years ago, asking for a list of agencies that are vetted amongst their criteria. And some of the criteria is they must be a home care organization with licensed, bonded, and caregivers that are on the list with their HCA number. And they also have to have been serving in Contra Costa for 5 years or more. Those are just a couple of the criteria that they gave. So there's a group of 23 agencies that came together as a collective and developed a brochure with lots of information. And each of the agencies are listed on the brochure. We work together. If I'm at capacity, I want to help a person find an agency to help them. So this is where it's nice when we know what each other specialize in. If I know it's somebody that's needing more of a live-in type situation, I reach out to Bach. If it's somebody that's needing shorter shifts or needs that care management piece, I reach out to Dale and say, gosh, this is who I would ask you to call. So we work together. And Dayna, I provided that Contra Costa County Home Care Collective. It was reviewed by John Muir's legal department. However, they are very clear that they don't endorse any one specific agency. But I will say that John Muir, Kaiser, and San Ramon Regional are all using this brochure exclusively, as well as many of the skilled nursing facilities. So we're very proud of that. The agencies pay for this brochure. We split the cost of the printing and making sure that it's up to date. So I think awesome. It's a great resource for people.
Yeah. And again, yeah, I will be attaching that to the follow-up email for all the people that are attending today. So I think that's awesome. Thank you for bringing that to our attention. And I know we kind of talked about, Bach did, about matching caregivers with personalities. And I've got to assume that once in a blue moon, you come across a very difficult client. I mean, I grew up being, understanding that if you were like a sassy pants young person, you might still be sassy as you're old, right? Or if you were like a negative Nelly as a younger person, you're probably still a negative Nelly, or maybe starting to show some signs of dementia, which can take various forms in your personality and your characteristics. How do you guys deal with that when you have to send a caregiver out to somebody that maybe is not the most pleasant person, or is difficult, really doesn't want to do what they're supposed to do. How the heck do you deal with that? I don't know who wants to take that. Dale, do you want to take that first?
Yeah, I'll start the conversation and then I'm going to pass it to David because he's actually the one that goes in the home and helps select the caregivers.
Got it.
In this COVID environment right now, with a caregiver shortage, I would say it's it's most important to find a personality that matches. It's probably more important than experience because we can train the training gaps, but personality and getting along with our clients is probably the most important thing. But it makes it very challenging when there's a shortage in caregivers. David, you want to kind of talk about how you address that situation?
Sure. I mean, right from the beginning at the assessment, I will talk with the clients and family members about that caregiver match. And so it is a two-way street, especially with a shortage of caregivers. You have some caregivers who say, nope, I don't want to go there anymore. Sometimes you have clients who say, this is not the right caregiver for me. So I try and prepare both the client and the caregiver. If the caregiver is going into a situation where somebody has dementia, I want a caregiver who understands dementia. That's part of our training. And it's a lot different if somebody with dementia curses you out versus somebody who has capacity and knows what they're doing. So if it's someone with capacity, I might talk to that person and say, look, you don't want a revolving door. So I know this is difficult. You're not used to having people in your house. They may not do things exactly as you want them to, but they're going to leave and you're going to see a different face every time. And that's hard on you. So some people can manage that. Somebody with dementia, I may be saying to the caregiver, yeah, this is what happens. You can step away. We provide that caregiver with support. And sometimes our caregivers become very attached to some of the most difficult clients. And so I don't like to assume right off the bat, just because somebody swung their cane at me, that it's going to be a bad relationship. And then you figure out what works with that person. Okay, that person responds well to, teasing or to food or to, what might it be? So that's part of what care management is managing those relationships.
Oh, I know.
Yeah, sorry.
Go ahead,
We
Bob.
also have, at the beginning of the assignment, we also have what we call, I explain this to the client immediately, that we will have what we call the matching process. And that they should be very patient in giving us enough time to find the right match for them. Just like what David said, the clients needs to like the caregivers and the caregiver needs to like it there. It's got to be both ways.
Yes, I totally get that. And I can totally relate to what you just said, David, because I was very close to both sets of my grandparents. One set lived in the Berkeley Hills and the other out in Alamo. And one of my grandmas was a little bit more curmudgeon-y than the other. The other was just like a little ball of sunshine. And my other one was a little bit more difficult and complaining. And I could get her to laugh. And I just loved it. And she was a handful, boy, but it just like you said, once you understood how to, push the right buttons and bring out that happy side, it was just so rewarding. And I would have the best time with her. But not everybody had that same experience. Anyway, enough about that. Is there anything else, David, you want to share about a care management plan? When you and I were speaking before, you mentioned something about 10 to 20 hours a week, and then how often you saw them. And again, I think you can also help with the medication management, which you touched on a little bit before. Is there anything else to add to what that care plan looks like and what it entails, and also what the costs might be of something like that?
Sure. I think that 10 to 20 hours a week, that might be a typo because, often I will be able to provide care management with 1 to 2 hours a week. Oh. So my rate, I usually bill hourly. So it's $170 an hour. We will provide a complimentary caregiving assessment when somebody's starting out. Sometimes the family recognizes, well, this is a lot more complicated than sending in a caregiver to do the grocery shopping and help mom with a bath. You know, there's a lot more moving pieces here. So they may want to complete geriatric care assessment. So there may be some more time I spend on the front end, identifying what the issues are, identifying resources. Typically though, I like it if I can see my clients every week, maybe every other week. I'm doing a health and wellness check when I'm there. So a little higher level of expertise than what the caregivers are doing, although I'm working closely with the caregivers, so they should be reporting change in status. But so I may be going into the home and managing physician's appointments. So I have, for instance, I have a client right now who was just recently diagnosed with something called a malt lymphoma. It started with gastric distress. Turns out that she had H. pylori, which is what causes ulcers, but it also can lead to stomach cancer. So she was really kind of shocked when I was with her at the oncology appointment when they told her she had cancer. Very treatable. Radiation, so we're arranging for the radiation. Part of what I'm doing, my background is in science, not medical, but I have my clients, my neurologists, they're all hematologists, and so I help them navigate the system. So I'm helping her and her family understand that she's frightened of the word cancer, but she's going to have 12 radiation treatments, and the outcome is likely to be very good. So I'm helping her manage her anxiety, helping her communicate with her husband and her daughter, and communicate back to the physician what's going on at home, and helping her understand, because she's got some dementia, a little bit of short-term memory loss. She can leave there not really retaining what happened. So I'm using this as an example of what a care manager can do. So I'm going into that house, and then I've got a baseline. I know how people are doing when they're doing well, and if things are changing, I may be arranging family meetings where we're talking about the fact that, okay, we need to bring more care in, or maybe care at home is not going to be the plan in the long run. So care management is holistic. I'm looking at the whole person and trying to help navigate over a course of time how to age. Most of us want to age in place. If we can achieve that, great, but to adjust to all of the changes that are coming down the road. So, so that's, I never answer anything with a simple answer. That's my complicated answer for you.
So
But you
David,
really, that's awesome.
yeah, David, I have a quick question too.
Sure.
For those folks who already have an existing care in place, not under a ROSA, for example, but they want some, a third person to step in and reassess them for what they need. Can they contact you?
Absolutely. It's a great question. And I do that all the time. And right now, I'm working with a woman who lives in Fremont, and that's our office is in Walnut Creek. We serve Fremont, but there's an agency down there that is already in place, and they're doing a wonderful job. And the fiduciary brought me in. And so I am monitoring the quality of care there, as well as managing other parts of the care. So yeah, I'm happy to do that.
Okay.
That's a really good question, Bach. And I do have another one to add on to what you just answered or asked, because I know you offer this through a ROSA, but Bach is just asked if you would help with another in-home care company. It sounds like that's a yes. And then I know of people that actually are independent geriatric care managers that do this as a business. And is there a difference between what they offer and what you offer?
Well, that's a good question. I really encourage people to look at aginglifecare.org.
Okay.
There's a feature on there called Find a Care Manager. You can put in your city or your zip code and see what care managers are in the area. And so we really are doing the same kinds of things. Because I'm associated with a ROSA, I work really closely with our staffers. And so if caregiving is part of the plan, I can do it one of two ways, and I'm transparent about this. So I can say, hey, we can get caregivers in there and I'll work closely with the caregivers, and I have a little more insight into what's going on with the staffing. Some people may prefer, they may say, like Bach was saying, it's like, well, we have another agency we're working with, or we'd like to keep it separate. Sometimes people bring me in just for care management. Sometimes they bring me in just to arrange caregiving, and sometimes they want both. So it's all available. And I'm always happy to refer to people in private practice. There's some great care managers out there. And as I said, if you look at that website, you can kind of see the different kinds of people who are doing this work.
Now, this is awesome because I can imagine, you know, caregivers can drive Mrs. Smith to the doctor.
Mm-hmm.
They can even help maybe Mrs. Smith get into the appointment, but they're not there to help work with the doctors on the care management itself, right? You're there actually acting as a representative of that person for their care, right?
That's exactly right. I was telling Dale a story that kind of represents the work I do. I had a relationship with a woman who passed away at the age of 98 after we'd been working with her almost 10 years. So I knew her over a course of time, very sharp woman. She had really bad arthritis and lost cartilage in her hip and was having chronic pain and was barely able to walk. So at about the age of 94, the orthopedist said, you know, without hip replacement, you'll be non-ambulatory and in chronic pain. But of course, the risk of doing hip replacement at that age is very high. Because I had a relationship with her and her daughters who lived in Oregon, we were able to have a very real conversation about whether or not she wanted to do this. And she chose to do it, knowing that she might not make it. And she did. There was a good outcome. She remained ambulatory and in much less pain. But I was able to have that conversation, go on that journey with the family in a way that I wouldn't have had I not had that relationship. So that's one thing I encourage people to involve a care manager, because you'll get that level of support. And the caregiver is not going to be able to do that.
That's awesome. Hey, I want to invite the participants now to go down to the little Q&A bubbles at the very bottom of your screen. Just hover over that bottom area of your screen and it says Q&A. If you want to ask a question of any of these amazing people while you've got them here, go ahead and type in your questions. And if not, we'll give you a minute to do that. And while you are, if there are any questions, you can be typing those in. But I'm going to just sort of open it up to the gang here and just ask Sherry, Bach, David, or Dale, is there anything else that I have failed to ask you or that we forgot to bring up or cover that you just want to really make sure people today leave knowing about or knowing a little bit about? Anything that we didn't talk about, Bach?
Yeah, I would like to add that for most people who don't know how to start or wanted to how to start, a common problem are those who are in denial of help. So denial is a coping mechanism that gives someone time to adjust to distressing situations. But staying in denial can interfere with the necessary steps that needs to be taken, can interfere with the needed assistance, the treatments, or your loved one's ability to tackle. Just like I want to remind people, take advantage of the free assessment with no obligation to hire. The assessment is not just us getting to know you, but also you getting informed of options that can help you make better decisions.
Thank you. I see a lot when I am out and about as a seniors real estate specialist and I'm meeting with couples. There's a lot of guilt over, I see that spouses feel it's their duty when they, said their marriage vows 40, 50, 60, 70 years ago that they would care for each other in sickness and in health. And that they feel it is their duty, not an outside caregiver, to care for their loved one. But what I also see is that that poor spouse is exhausted and not getting any, breaks or a rest. But I don't know how you get past that when you have such love between, a couple, and that guilt that they should be doing it and they aren't ready to let someone else help. Is there any way we can work through that with them?
I think it's important to acknowledge that guilt and to let them know that they've done a tremendous job. It's not that they're not able to, and talk about caregiver burnout. It is a real thing, and it creeps up quickly and it hits you fast. And so self-care is so important for them to be an effective caregiver. So it's not that they won't still be participating in the care if they choose to, but it's a way for them to, have self-care and rejuvenate themselves so that they can be as, patient and loving as possible, because we tend to start to lose patience and aren't as effective as we want to be. So I try to acknowledge that guilt that comes with, and just let them know they've done a great job. It's not that they aren't able to. Anybody else?
Right. Well, and then that's where they might be able to take advantage of someone like a Rosa Care or other agencies like that might be able to step in and help an hour or two here and there. That's a great way to dip your toe into what in-home caregiving could or would be moving forward, because the loved one wants to be there in the long run, to be with their loved one. But if they don't take care of themselves, the tables might turn, right?
Yeah, and I will say that I work a lot with family caregivers and sometimes spend my time exclusively. I may have a separate meeting with them because they need support. And I think sometimes most of the focus is on the family caregiver to make sure they're getting the support they need, because without that person, it all falls apart.
Yeah. Okay. Okay. And I don't see. We have a couple questions, if I may jump into that a little bit. What about patient advocates? Have you worked with anyone with this training? Well, I don't even know what that is. Who wants to take that? Oh, you're muted, David.
Muted.
Thank you. First time I did that. I think the question goes to this issue of navigating healthcare systems, whether it's insurance or working with different healthcare providers. So I do that, and sometimes I refer to people who specialize in that, but that is something I do. Sometimes that can be an entire job if you're trying to, if for instance somebody's being denied care that they think they need. So it can be a lot of work trying to appeal that and go through all that.
Interesting. Okay. And
I'll just really quickly say there is a certification for patient advocates, and we've actually worked with one previously to help provide caregiver services. They're very similar to a geriatric care manager or an aging life care manager.
Excellent. Thank you. Awesome.
Sure.
I have a good question. How do you deal with siblings that have different options and opinions about getting parents in-home care? Any tips?
I'm happy to jump in here. It can be tough. I mean, I answered online, and you want to make sure everybody is being heard. I think we want to start with the client. If the client has capacity, if you can determine what is important to the client, you have to make sure that you're honoring that. And then you want to hear what the different points of view are. And that's very typical. You have one sibling who says, Mom is fine, you're coming on too strong, back off. And others says, you don't live in town, you've got your head in the sand. So it may be educating both people as to talking about things like, okay, Mom does need more help, and that comes along with aging. You're saying that to the sibling who thinks everything is fine, and to the sibling who thinks we gotta, wrap them in bubble wrap, you say, but it's important to Mom that she's not, hovered over by caregivers 24/7. So what kind of risk can we take? So I might have a family meeting, and there are a lot of different ways to approach it, but I start with a lot of conversations and try and avoid court. So I'm currently working with somebody where it wound up going to court, and now the court appointed a conservator, and they've lost their ability to make decisions on their own because they couldn't resolve it on their own. So yeah.
Ooh.
I think a key piece, Dayna, is communication amongst family members, and have those conversations early. Sit down and say, if and when the time comes where you might need some extra help, mom or dad, what would that look like for you? What would your preference be? Do you want to stay in your home? Do you want to be in a smaller boarding care or an assisted living community? Do they have their advanced healthcare directive in place so that the kids don't have to argue over this? It's very well written what measures they want to have taken or not taken. So
Right.
Planning and communication is so important. And the kids, to David's point, need to honor their wishes. And so while they have capacity, talk about these things. What would it look like? What are your wishes?
Yes, thank you. I think we have weird Wi-Fi here. I'm getting some interesting feedback. So I think that was a perfect segue. Well, not only that, before we jump in and wrap up, that was a perfect segue to the fact that next month on October 6th, we're going to be talking about assisted living versus independent living. So you mentioned that also, and that can take that can be someplace with the continuum of care. It can be just independent, it can be just assisted, it can be a smaller care home. So we'll be covering that next month on October 6th. And as a reminder, we're going to continue bringing this via Zoom webinars through the rest of the year, and keeping our fingers crossed that we can meet again in person next year back at the Lafayette Library. So with that, if there aren't any other questions, which I don't think there are, I just want to give a huge thank you to our wonderful panelists. You guys are awesome. What you do is amazing. Your knowledge, your experience, and thank you for your time today. I know you're busy caring for all of our wonderful seniors in our communities. So continue to be well, continue to do the good works that you're doing, and God bless everybody today. And we will hopefully see you all next month. And be well, have a happy day. Bye.
Thanks, Dayna.
Thank you, Dayna,
Thank
so much for the
you.
opportunity.
Bye.
Bye.